and thank you everyone to join me because it's 8 right in Sydney. Um, so today, as Tabitha already said, we will talk about photography and why to make it a standard in your practice. I won't present myself because Tabitha already have done it. So Data Janice, but also a diploma in management human resources. And today I'm the head of the global Swiss Dental Academy for EMS. But let's go on with this. We already have done the introduction. I don't like to talk about myself. So today we will talk about dental photography, why it's so important to have it. It it makes our work even easier. How to speak with the patients, how to speak with colleagues, how to create really a good database, but also um, something that we can track over time and about the health and the status of the patient. All the shots that we will see here, they are only recommendations. As I said before, and I was talking with Tabitha about it, photography is try and error. So we need to try a bunch of things just to see what's going to work with us and what's going to work with the equipment that we will choose. We will talk also a little bit about the equipment. Even if you fail treatments, don't stop to document these failures. Why? Because we learn with it, and we need to document failures and not only success. So really take photos of from everything. First appointment, it's a must, and then you have always the follow up with the patients. So the benefits. The benefits. I will talk a little bit more about mobile dental photography because it's my choice, and you will understand why a little bit further on this presentation. But I like it because it's easy to control. So it has a small opening to the diaphragm, so we can have an aperture way better with the mobile phone. The ISO adjustment is easier also. The resolution is way better now with the new Samsungs and new iPhones. So here I think the tricks and the tips that I will give you is more like how to make it easy. And for someone that is beginning in photography, how to use your mobile phone. Don't need to invest like thousands of dollars in the new equipment. We can use our phone and invest a little bit more in lighting. That will change a lot the photography. But let's start with the reasons. So the reasons why dental photography should be essential in your practice. And the first thing is for diagnosis and treatment plan. Photos will help us to sketch the future treatment. Here, mostly for the dentist specialists in the aesthetics, they use it a lot, the dental photography, to already design crowns, veneers, restorations, whatever, and already have a look on the final results. And here, this kind of photographies is quite representative because we can see through the photography the length of the crown, and then with the black contraster, it's even easier because we can isolate the segment that we want to work on, and it will help us on the already in projecting ourselves at the end of the treatment. Second thing, patient education and communication. I use a lot the dental photography to communicate with patients, to show where they need to work a little bit better, the results that we are getting over the time, but also to show them then with the final photo what kind of home care they need to do. And here the two photos on below, they are quite representative because on the left we have a photo before the disclosing, and even with all my experience as a clinician, there's some areas that I don't see the biofilm, and once we have the disclosure and we can show this before and after to the patient, now I can see the areas that there's a little bit more difficult to brush, and we can show that it's not a myth, it's something that exists on the mouth of the patient. Of course, legal documentation also, the assurance, and mostly in accident cases, we really need to document all the case. And sometimes it's a dentist nightmare. The biggest dentist nightmare is the malpractice lawsuits, right? So in certain cases, we may also find ourselves as the treating doctor following a possible incident. So a proper photo documentation may help a mistreated patient, or on the other hand, defend a colleague who was provided appropriate treatment. So it can perhaps even may save you from a patient that is saying that you have done a bad job, but actually no, you documented the cases and that was the solution, and you got the good result. Again, insurance verification. Sometimes we have these treatments over time, and we can have the before and after, and follow the patients and make some concessions about the defects that we can find. Five reason. The fifth reason is to consult with the specialists. So when we do referrals, and here we have two of my cases. So we can see the right lateral border of the tank, that this was a leukoplakia, and also the last photo that was really this. I'm forgetting the word in English, but we have the bone structure that is appearing, and it was a patient with biphosphonates in this reason. So sometimes even I receive photographs from referring dentists or mutual patients and their recent surgical sites, so that I may access the healing infection without the patient physically present in my office. Even now with the COVID situation, we use a lot the dentistry, so photos, they were really nice to follow periodontal patients, for example, in my case. In our practice, we use it a lot for lab communication, also to show the color, to show the position of the teeth, to also write on the photo how we want the crown, or how we want the treatment to be handle. So it's really nice to have something visual to communicate with the lab. Sometimes the lab is not like 2 steps away from our treatment room. They are most times 10 kilometers. So this is a good way to make the job right at the first try. Of course, professional advertising marketing. This I use a lot, to be honest with you. So I always have the before and after. And here you can see in French, because most of my practice was in French part of Switzerland, so we talk French. And this is quite visual, so the patient understand with a simple look. And of course, I use it a lot as a professional advertising in my social media. Here you have my Instagram profile, where I was building a portfolio of dental practice, also a lot of management about the practice on my profile. But we need to understand there's kind of a competition between the dental clinicians, and sometimes we are a little bit hold back or stuck with the legal entity, and we cannot do a big publicity, but our social media is a good way to do it. And here, honestly, I do it for passion, because I really like to show the cases, and I really like my clinician life, to be honest with you. So here you will have some good results. I got a lot of patients through my Instagram page, and a lot others more internationally that I sent to friends, because they ask for advices, and they asked if we know someone that can help them. As a prophylaxis manager in the past, I use it a lot, dental photography, as a professional tool, also to instruct my team. So I had, at the end, I had 63 dental hygienists in my team, and all of them had the protocol with clinical photos done by me. This one, they weren't the case. They were done by other clinicians, but just to illustrate the case. Um, so it's important if you are building protocols in your clinic, and if you want to share really good instruction and a little bit these protocols dummy proof, like I like to say, you need to documentate every single step. If you go look on the internet, it's difficult to find the image that we want. So what better thing to do? Take your own pictures. And like that, you will have the good technique, the good positioning, and the good image to illustrate the protocol. Then self-education improvement. I do it a lot to the patients also, so they can take the photos with them, or we send the photos by email with areas that they need to improve, but also mostly in the office, because we have the before and after. It's funny because we take a lot of pictures, patients sometimes they came to the practice and they say, okay, so let's see if I still have the same amount of dental plaque, or if I'm better. So we do the disclosure, we take the picture, and then we compare with the picture that we have in the file of the patient. So this is quite cool, because there's a kind of competition of and if we improve, there's a reward that they saw really that they are improving, and our advice is working also. And also we are putting the responsibility in the side of the patient, because they will try to work it out at home, and then they can compare once they came to the office with the old pictures. And the treatment philosophy and work ethic. I like to do it. It motivates myself also to see before and after pictures. This is one of my best cases. That was a patient that were coming to the office every 3 months, never with good results. Then we started using the guided biofilm therapy, and for this we disclosed and we took pictures. And when I have the patient saying, this is disgusting, I have all of this in my mouth, so they realize and they can see through the picture, through the mirror, and through the picture once we put it on the file, and they start getting motivated and they want to improve. Then, of course, after GBT treatment, and the good thing is this patient she kept coming every 2 to 3 months. And 6 months after, I took another picture and I got this picture. As you can see, the gum are really better. Still some areas with small inflammation, but way better. We don't have the calculus like we had before. So it's working, and we were working with the patient. So this is kind of like, I encourage my patients, I encourage my clinicians to photograph every case as if it were going to be published. Why? Because by taking the time to take this picture, we take the time also to talk with the patient, and in a way we are already preparing the recall, the follow up. We are already preparing like next appointment, how we're gonna speak with the patient, what we're gonna access together. So that's is kind of good. Of course, I always tell them also to have the minimal blood as possible, minimal saliva. Sometimes it happens here. For me, it's not a perfect photo because we have these little bubbles in between the teeth, but it was complicated person to take it. Even with the Optrogate, she was always complaining about having the mouth open. So I don't use a lot the Optrigate. I prefer to use these black retractors, and I will show you some pictures about it. This is another case, like a severe one with a lot of calculus, periodontitis, patient always disclosure, motivation. Here is almost impossible to avoid the blood because it was the first interaction with the patient. So, but it's always good to document the cases. Another one, a patient with taking more than 1 liter of IST a day, a lot of demineralization, and you can see that the home care is not the best. But once we work with the patient and we explain, when we have also this capability to show the results, because we have before and after, they see the progress. And when they see the progress, they start believing. And when they believe, they keep coming. They keep coming, and they bring new patients with them. So that's quite good, and that's why I'm using the dental photography in my daily practice. So I gave you 10 reasons. I hope they are enough. So now that I have the 10 reasons, we can talk a little bit more about dental photography, because if you don't believe in dental photography, it's going to be hard to you to put it in place. It takes a little bit more time. In the beginning, like I said, try and error. So sometimes you will miss some shots. Don't worry, even the missed shots, they are important for the learning curve. I don't show here my first photo, but my first photo, it was really miserable without light. So it was completely dark. So, but tricks to get quality photographs. First thing, you need to choose the equipment. Okay, you can have a reflex that costs thousands of dollars, or you can opt about the mobile situation. For me, it's a good compromise. And all the photos that you saw until now, they were taken with my mobile phone. So, and it was quite good. For me, the most important in photography, it's going to be the lighting. And we will talk a little bit about this. Of course, there's some accessories. We have the retractors. I use black retractors because it looks nicer. Of course, there's the contrasters. I use these contrasters from Smileline. They are quite good because you can bend the contrasters, so you can position quite easily in the mouth of the patient. And of course, the mirrors. The mirrors, they are must. My favorite one is this one on the upper side because it's a steel. It's all in steels, but it reflects quite well. It doesn't scratch, and it's really easy to sterilize. Then work in the position. So take your partner or take your dental assistant and work on the position. Try and error again. Do it only with the retractor. Then try to use the contrasters in different positions. And like you see here, the contraster is bent. So bend the contraster so it's not in front of the length. And then the mirrors. The mirrors here on the upper right is a straight mirror. I don't like it too much. I use a curved one, this one, the steel one, that is easier and it doesn't stay in front of the camera. And then the lateral view with the most small mirrors. So, but work on it, try and error again. It's difficult for us here because I'm only giving you the theory. Hopefully next time we can have a physical course and then we can try all these techniques. And then again, you have here different positions. This is taken from the clinical photography manual by Chris. And but what I want to show here, the important way is the focus length. The focus length always at 22, and the speed of the aperture like 1/200. you always need to take, I don't know if we have orthodontists here, but you orthodontists, you are the best one to take these kind of pictures. But always take a frontal view, occlusal, and then lateral view. And like that, you have the case completely documented, and it's quite fast to do once you have the experience. An orthodontist can take this in less than 4 minutes. So, and I learned with one of the best, with Dr. Giuseppe Mercury, and it was really good to spend his time and show me how to take the proper pictures some years ago. Okay, but what is my choice? My choice is mobile photography and to use a light box like this one. This is the light box from Smileline. The good thing is you have central LEDs, you have lateral LEDs, and you have the diffusers. The diffusers is here on these white plaques. And of course, the polarized filter for some of the cases, mostly when you are working with the lab, it's always good to have it. For intraoral photographies, what you need to do, hold the lips. How you can do this? So you can hold the lips with retractors or with Optrogate. Optrogate, it works quite well. It balances the light also a little bit, so it works like a diffuser. And I prefer the black ones because there is the contrast between the teeth, gums, and the retractor. But okay, you can choose again, try and error. Place the patient in the 45 angle. It's easier for the photo. It's easier to take the front view, occlusal, and lateral view, and you don't need to change the position of the chair. Disinfect the mobile. Again, opaque retractor. Don't use the transparents. I show you the transparents because I didn't have the photos about the ones that I use, because they are from Indus Belo. It's a Brazilian company, really nicely done. They have these in different colors. They have opaque white, opaque green, and opaque black, and I think it's really good to use it. The light is the most important. So the ideal is always to diffuse the light so we can lower the intensity of it. Here you have some examples. The upper image is when I use my light box, the Smileline, only with the central LEDs in the middle activated and the lateral ones on off. And as you can see, there was more bright on the central parts and less on the canine and premolars. On the lateral, with the lateral LEDs, that is the ones that I use the most, and with the central LEDs off, you can see that by using the lateral ones, you have a more uniform light, so a more real picture. And here in the two pictures, if you notice the gum, you can see this like orange skin on the gum, so we are getting all the contours. That's why it's really good, and I prefer to have lateral diffuses and use as less as we can the central LEDs. And I will show you where I use the central LEDs. So always the lateral lights and with diffusers. I use the diffusers a lot because it's a more uniform light. And here on the upper image, you can see even better the gum with all the contour. Because why? Because we are using the lateral LEDs with diffusers. So it's a less intensive light, but more homogeneous, more uniform. So unlike that, you can see really the health of this gum and the brightness of the tooth with the good color. You're not cheating, and you are not putting like more light on the central incisors. So if we are doing a whitening, for example, here you are having the right color, the real color. Then for the For some aesthetic treatments, it's good to have the polarized filter if you are working with lab, or if you are doing some composite veneers, for example. Here you can use the polarized filter and see the areas that are more transparent, more opaque. It's quite good. Always, when you are using the filter, always use the contraster, a black contraster, so it's easier to have the comparison. So here on the upper is just the diffusers with the polarized, so it's an hybrid technique. But again, always the contraster behind. I don't use it a lot. I don't see the necessity, but there's a possibility. Again, try and error. It depends what kind of work, dental work you are doing in the mouth of the patient. So you can try it. If you are having, if you want image from the posterior area, there is a place where you're going to use all the LEDs, the central LEDs and the lateral LEDs, full power, without the diffuser. Like that, you have this image like this one. This is a carry treatment where they really wanted to document it, so we took the picture with the full LEDs on. Okay, but let's go a little bit in definitions. When we are talking about mobile photography, I'm saying that it's easier, but there's some settings that need to be handled like a DSLR, like a reflex camera. One of the things, and this is the most important one, is the white balance. If you keep the white balance in auto, your mobile phone, it will adapt to the light, and we don't want that, because we are already controlling the light with the LEDs. We are already like getting rid of all the artificial lights, so we can have the real color of the teeth, the real color of the gum. So what we need to do is to establish a white balance at the same length as the LEDs. So we change the white balance and we put it at 5,500 K. This is the only thing that you need to do. Then the distance from the mouth of the patient of four fingers, like this, and zoom a little bit, just to between 1.5 to 2 times, and like that you will align. I advise you also to use the grill, because with the grill you can always have the same kind of photo and well position the camera. So this is quite easy. For the extraoral photographs, make it always as a portrait. Ask the patient to smile, but a natural smile, not just like forcing the smile. Otherwise, we don't have the real gum line, so to say, that will appear in the natural smile of the patient. Center with the nose of the patient, and we need to be careful not to have shadows behind. So for that, use the diffusers, but same thing of both sides, and always a white or a black background. I prefer a black one. It's easier to control the shadows than the white one, and always a distance of 50 to 60 centimeters. And the phone level is going to be always the eyes of the patient, so it's quite easy to notice. Doing the summary, because we are talking more theory and less practical side. So always before and after photographs, they are the best way to prove the work, but also to have this follow-up with the patient, right? So you can control if the patient is improving or going downhill, and you also can use it to maintain the motivation of the patient. So it's going to be good to complete the files of the patient. So we're going to have a better diagnosis with it, and at the same time, a more complete file. Sometimes in the practice, and I was running a really big practice, so we have a lot of different patients on it, and clinicians, and sometimes the clinicians they change. So and to have the same protocol, we implement the guidelines, but at the same time, they saw the file of the patient, and they could understand since the beginning what have been done and what were the motivation of the patient also, and why we were getting this treatment plan. So it was good also to have a continuity in the treatment of the patient. So it's quite good. Use it for social media. Social media is maybe an underrated tool these days in dentistry. I honestly, I got a lot good feedback from social media, a lot of patients, a lot of good relations with the other professionals through social media. So for me, it's quite a good network to learn, but also to share knowledge with clinicians and with patients, and is a good way to advertise your great work. Again, it's easier to communicate with the patients. I use it a lot. I have a really big screen in the practice, and I use it the iPad a lot with the pictures that we took to show the patient what we were doing and why we were doing that. And sometimes I was always drawing a little bit on the iPads, also the areas that he need to improve and the areas that we were working on it and what we were doing in the future. So it was kind of funny because mostly of the specialists, they were sending me the patients, so to do the prophylaxis, and at the same time to take the pictures. Why? Because we could have this teamwork and explain together the next steps of the treatment plan with the pictures. So it was a good teamwork in that way. And of course, if we have some doubts, we don't need to bring the specialist on our treatment room so they can pick on the mouth of the patient. We take the pictures and we can share the pictures with them. Be careful. One important thing during the health questionnaires, all patients, they were already signing a consentment that they were approving to use the pictures internally, but also externally. So that's an important thing, and for the confidentiality, it's important to have it. So do a kind of standard document where the patient can sign, and they can sign that you can share the pictures. As you saw, all my pictures, they don't have the face of the patient except this one, but this is a friend, so it's okay. So and like that, there's no problem. No one will recognize them. And I even have pictures from my wife in the middle of the photo, so it's quite interesting. But this is an important side, and just to avoid problems in the future, do this document and make it as a standard, so every patient can cross-check it and sign it on the health questionnaire, and it's good. From my side, I think I talked a little bit too fast, but I think it's okay because we're gonna leave more time for questions and answers from my side. I hope. Obrigado, thank you, and merci.